Hi, I'm Shakiva Loomis, nurse practitioner student at University of Memphis. This is my patient. I'm going to wash my hands and then please scan the room. Alright, I'm going to start by assessing my patient's skin all over, and I'm looking at color, temperature, texture, moisture, edema, tugger. We're going to look for bruising, lesions, nevy, and scarring. The next thing we're going to do is assess scalp, and I'm looking at hair distribution, texture, and color. I'm also going to feel for depressions, infestations, masses, and tenderness. His temporal arteries, I'm feeling bilaterally for tenderness. I'm assessing cranial nerve number 5. First, I'm assessing TMJ. We open and close your mouth, and close, okay? And there's no crepitus, subluxation, or tenderness. I'm going to assess cranial nerve number 5 in that same place. Will you clench your jaw for me? Clench, and there's no tenderness. The next part of cranial nerve number 5 is light touch. Will you close your eyes and tell me where you feel this? Close your eyes.
Yes. Yes. Yes.
Where?
Jaw.
Okay. Very good. And the next thing we're going to do is lymph nodes, and we're going to assess pre-auricular, post-auricular, and I'm palpating tonsillar, submandibular, submental, anterior cervical, posterior cervical, occipital, and supraclavicular. The next thing we're going to do is assess cranial nerve number 7, and that's looking at the symmetry of his face. Will you smile for me? Frown, puff your jaws, puff your lips, raise your eyebrows. Very good. The next thing we're going to do is go to the ears, and bilaterally I'm looking at the symmetry of them, and I'm feeling the peni and the tragus for tenderness and masses. Then we're going to look into the auditory canal, and we're going to assess the tympanic membrane with the otoscope bilaterally. I'm going to lift up and back. Okay. And tympanic membrane is clear. No signs of symptom of infection. It's concave and gray. The next thing I'm going to do is assess his cranial nerve number 8, and that's hearing. I'm going to whisper something to you, and you tell me what I say.
$99.
Okay.
99.
Okay. And the next thing we're going to do is assess the Weber test, and tell me, do you feel this on both sides equally?
Yes.
Okay. And then we're going to, that's the Weber test. We're going to do the Rainey test. And we're assessing whether air conduction is greater than bone conduction. You feel this?
Yes.
You hear it?
Yes.
And we're going to do that bilaterally. Do you feel it?
Yes.
You hear it?
Yes.
Okay, very good. Okay. We're going to assess the eyes now. And I'm looking at his eyelashes and his eyebrows and the fissures of his eyes. I'm going to pull down his eyes, and I'm going to look at his sclera and his conjunctiva, and I'm looking for any redness or discharge or any sign of symptom of infection. The next thing we're going to do is assess cranial nerve number 2, and this is looking at gross visual acuity. We're going to use the Snellen scale. Would you read the lowest line for me on the Snellen scale?
A, C, D, X, E, L.
I'm sorry, put one hand over your eye and read.
A, C, D, X, E, L.
Go to the next one.
A, C, D, X, E, L.
Okay, very good. Next thing we're going to assess the central peripheral vision. Will you tell me when you see my hands?
See him?
Okay, you saw?
Yes.
Okay. All right, and then the next thing we're going to do is assess cranial nerve number 3, and we're looking at consensual and direct consensual pupillary responses on both eyes. And normally the lights will be off, but for time's sake, okay. And they are both direct and consensual. They are both reacting directly and consensually. Next thing we're going to do is accommodation and convergence. Will you look at my hand? Look at the wall behind me. Look at my hand. Look at the wall behind me. Very good. Then we're going to do your EOMs. Follow my hand with your eyes. And this is cranial nerve 3, 4, and 6. Okay, very good. The next thing we're going to do is use the otoscope to look at the internal eye structures and assess for red reflex. Okay. Go in. All right. And okay, very good. And I did see the red reflex in his eyes. Now we're going to the nose. So we're going to I'm looking at the symmetry and make sure it's midline. Put one finger over each nostril for me. And just one, just check your pacing. In and out. One finger, and the next nostril. The next nostril. Over it. All right, very good. And then close your eyes. Okay, and tell me what you smell.
Lemon.
Okay, very good. And then the next thing we're going to do is assess his sinuses, his frontal and maxillary sinuses. All right, and then we're going to his mouth. We're going to look at, I'm going to have, in normal situations, I would have a tongue depressor, but we're going to, so we're going to have to make this work. But I'm going to look at his, say eye for me. Eye. Okay. All right, my tongue person. Okay, very good. All right, and so we're looking at I'm looking at his lips, his teeth, his gums. The eye again for me. His tongue. Lift your tongue up for me. The roof of his mouth. The buccal mucosa. His posterior pharynx and his tonsils, which are 2+ and present. And I'm also I looked when I stick your tongue. I said eye again. And we're looking for cranial. This is cranial nerve number 9 and 10. His uvula and south palate rise with phonation. And stick the tongue out again. And this is cranial nerve number 12. And his tongue is midline with no vascularizations. The next thing we're going to do is the neck. I'm assessed for the trachea. And I'm making sure it's midline. I'm going to stand behind him. I'm going to feel for his thyroid. I feel it. I'm going to push to the side, swallow. Okay, swallow again. Very good. Thyroid is intact. Trachea is midline. I'm going to feel of his carotid artery. I'm going to palpate them bilaterally. Then I'm going to listen to them bilaterally. Okay, and then we're going to assess cranial nerve number 11. So shrug your shoulders and I'm going to push down the resistance. Okay. Very good. And while we're here, we're going to do range of motion of your neck. So flex your head, lift it up, the back, side to side, and round. Okay, very good. So now we're going on to the respiratory system. I want you to turn around, turn the back for me, okay? And first and foremost, I'm looking at the symmetry of his back, and I'm making sure there's no obvious deformities. I'm also making sure there's no signs of respiratory distress. I'm going to start. I'm going to palpate to make sure, breathe deeper breath in and out for me. I'm just making sure that the chest is rising and falling symmetrically. And then we're going to start by doing tactile for Midas. Say 99. 99.
89.
Okay, very good. And then we're going to percuss. Okay. Then we're going to listen. Deep breath in and out. In and out. In. Okay, we're going to listen to his lateral lung feels bilaterally. And then we're going to assess for consolidations with bronchophony, egophony, and whisper pachyloquy. Bronchophony, we're going to, I want you to say B for me.
B. 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 B.
Egophony, I want you to say 99.
99. 99. 99. 99. 99. 99. 99. 99.
Whisper, 99. Okay, very good. Turn it around to the front. We're going to assess the anterior chest wall. We also are looking for symmetry and deformities, and we'll make sure there's no signs of respiratory distress, no pulling, no wheezing or retractions or anything, no cyanosis. And then we're going to do tactile firmitis on the front, the anterior portion of the respiratory system. Say 99.
99. 99.
Okay. Then we're going to listen. Breath in and out. Okay. In and out. In and out. In and out. In and out. Okay. All right, and then we're going to go on to the cardiovascular system. We're going to listen with the bell and the regular portion of our stethoscope to the 5 heart chambers, and we're going to start with the aortic, the second right intercostal space, the pulmonic, the second left intercostal space, Ertz point, tricuspid, and mitral. We're also, this is the point of PMI, and we're also going to palpate this area, and then we're going to listen for a full minute to assess the rate and rhythm of the heart. We're also going to listen to this with our bell, the same 5 heart chambers. Okay. All right, and so we're going to have the patient come and lay down. Okay, lay down. All right. And so as he's laying down, I'm assessing he's and lifts. And I'm assessing for JVD. You can hold your head. You could have stayed on that pillow. I kept that pillow there. You don't need to. You need to be laying at 35. Come on, lift up a little bit. Okay, slide up a little bit. Okay, come stand behind me. Okay. All right. So and we assess for JVD, and he's in lifts. And now I'm going to palpate for 3 of those 5 heart chambers. Okay, and then I'm going to listen again to them. All right, then we're going to go to the GI system. We're looking at the symmetry and the contour of the abdomen. I'm going to attempt to pull his shirt up. And after that, we're going to assess the arteries in the abdomen. So we're going to listen to the aortic. Move your hand, move your hand. Okay. And then the renal, iliac, and femoral. Okay. Then we're going to assess the bowel sounds. And we're going to start the right lower quadrant. And we're going to work up. Okay. And then we're going to percuss the 5 quadrants. And we're looking for tympany, resonance, and flatness. And then we're going to go in with light touch in the 5 quadrants. And then we'll go in with deep touch. And we're assessing for masses and tenderness in the right upper quadrant, the liver, and the left upper quadrant, the spleen. And then we're going to have the patient sit back up. And we're going to assess for CVA tenderness. And when he sits up, and so lift over for me. Does it hurt?
No.
Does it hurt?
No.
Okay. Come on, sit back up here. All right. Now we're gonna assess the musculoskeletal system, and I'm going to first start by assessing all of my joints, and I'm looking for tenderness, swelling, crepitus, deformity, symmetry, and anything that's abnormal in my joints. And I'm starting with my fingers, my wrists, my elbows, shoulders, knees, hips, ankles, and toes. And then the next thing we're going to do is assess capillary refills, upper and bottom. So we're looking at all the fingernails. Okay, take it shots off for me. And then we're going to assess his toes. Okay. And then we're going to assess his pulses, upper and lower. And this is the radial pulse. And we're going to assess it bilaterally. And then the posterior tibial pulse and the dorsalis pedis pulse. Okay? And the next thing we're going to do is we're going to assess for light touch. Close your eyes. Tell me if you feel this.
Sure. Yes.
Upper and lower.
Yes. Yes.
Okay? And then we're going to assess, we're going to assess vibratory sensation, upper and lower. Feel that?
Yes.
On the radial.
Yes.
And then medial.
Yes.
Medial malleolus.
Yes.
Okay. Very good. And then we're going to assess cerebellum coordination. Can you do finger opposition for me? Very good. And then finger to finger touch. Take your finger and touch mine. Very good. Very good. Your hand flaps in your lap. Back and forth. And then we're gonna do stereognosis and gasthesia. And I want you to tell me, close your eyes, and tell me what you have in your hand. Open your hand. Tell me what you have in your hand.
Pen.
Okay.
Pen.
All right. And then what I write in your hand. What I write in your hand. You can't look.
Number.
You can't look.
3.
Okay.
3.
Okay. Very good. Where your eyes closed? Okay. Then the next thing we're going to do is deep tendon reflexes, upper and lower. And so we're going to start with the brachial radialis. I'm sorry, I'm going wrong thing. I'm going to get my 24th, and I'm gonna hit this. Okay, relax for me. All right. We're gonna do that on the brachial radialis. We're gonna do the bicep. Relax on. And then the tricep. And then we're going to do the patella. Relax. And the Achilles. And then the Babinski. Okay, very good. Now we're going to do range of motion. And we're going to start with our hands. So we're going to flex. Fingers, we're going to start with our fingers. Flex, extend, hyperextend, adduction, out, fingers out, thing, open them up, close them, adduction, and thumb opposition. Okay, then your wrist, flex, extend, hyperextend, radial deviation, ulnar deviation, rotation. Okay, and then your elbows, flex, extend, hyperextend. Okay, and your shoulders, we're gonna flex, extend, hyperextend, adduction, internal rotation, external rotation, and circumduction. Okay, your toes, we're going to flex them, go to point down, then regular, and then up, and then adduction out, and your toes, just fan them out, and then close them back up. And then your ankles, we're gonna plant flex down, dorsal flex up. We're gonna do eversion in, inversion in, and eversion out, and then rotation. Okay, and stand up. We're gonna do your knees. We're gonna flex, extend, and hyperextend. Flex, extend, hyperextend. Okay, flex, extend, hyperextend. I'm sorry, both legs. Okay, hyperextend. All right, and then your hips, we're going to flex, extend. Okay, both hips, and extend. Okay, and then we'll kick back, hyperextend, hyperextend. Okay, and then we're going to internal rotation, external rotation, and circumduction. Okay, same here. Internal rotation, external rotation, circumduction. And then we're gonna do adduction, 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 adduction. Very good. Okay, and then bend over for me. I'm assessing the spine, the S curvature to make sure there's no scoliosis, and also stand up. That's extend and bend back, hyperextension. Okay, side to side, side to side, and then side to side lateral flexions. Okay, and then close your eyes, put your arm out. Okay, close your eye. Very good. And then walk forward. Okay, and then walk backward, heel to toe. Okay, and then close your eyes, one leg up and jump on it. And that concludes my head to toe.